also going to be going on into my topic for today, which was asked for, special requests, and that is on varicose vein. So let's start. So this is something I know a lot of people trouble with, and so I'm going to go through it as quickly as possible. So what is varicose veins? So varicose veins are swollen, twisted blood vessels that bulge just under your skin surface. These sometimes either look blue or purplish and appear on your legs, your feet, your ankles, some in the back of your knees. They can be painful or itchy at times. So this is what the legs usually look like. These are what the veins look like. This is what your normal veins are supposed to look like. And this is what your varicose veins look like at the bottom. So what are the symptoms of these varicose veins? Again, you have the bulging veins, which are twisted. They're like rope-like veins, and often bluish or purple. They appear just below the surface, again, as I indicated. They can develop in clusters. Tiny red or blue lines or spider veins may appear nearby those as well. Heavy legs. Muscles in your legs may feel tired, heavy, or sluggish, especially after physical activity. It may be itching. The area around the varicose veins may itch you. That's not uncommon. Pain. Legs may be painful, achy, or sore, especially behind your knees, and you might have muscle cramps. Swelling. Your legs, ankles, and feet can swell and throb from these. And again, skin discoloration and ulcers can also happen. So if left untreated, varicose veins can cause brown discolorations on your skin. Severe varicose veins can cause venous ulcers or sores on your skin. So it's not something you should just ignore whenever if you have these. So what are the risk factors? Age. Aging causes wear and tear on the valves in the veins that help to control blood flow. Eventually, that wear causes the valves to allow some blood to flow back into the veins where it collects. Sex. Women are more likely to develop this condition. Hormonal changes before a menstrual period or during pregnancy or menopause might be a factor because female hormones tend to relax vein walls. Hormone treatments such as birth control pills might increase the risk of varicose veins as well. Pregnancy. During pregnancy, the blood volume in the body increases. This change supports the growing baby, but can also enlarge the veins in your legs. And of course, family history always plays a role in a lot of conditions. Obesity, being overweight, puts added pressure on your veins, and standing or sitting for long periods of time. So movement is important and because it helps with blood flow. Now, there are different stages. There are 5 stages. Stage 1, you may have like a spider-looking vein. Stage 2, the varicose valves you see the colors change. Stage 3, the leg becomes edematous. And stage 4, you see a lot of changes. So you see people sometimes walk around, you have the blue, the red, purple veins throughout the entire leg. And then on stage 5, of course, there are ulcers. So what are the treatments? Treatment for varicose veins may include self-care measures, compression stockings, and surgeries or procedures. Procedures to treat varicose veins are often done as an outpatient procedure, which means you usually go home the same day. So you don't usually stay in the hospital long. Self-care, such as exercise, raising the legs when sitting or lying, or wearing compression stockings can help ease the pain of varicose veins and might prevent them from getting worse. Compression stockings, again, as I just talked about, so these you can get like in any store, any pharmacy, you can always get those. If self-care steps and compression stockings don't work or varicose veins are more severe, a healthcare provider might recommend surgery or other procedures. Larger veins are generally treated with ligation and stripping, laser treatment, or radiofrequency treatment. In some cases, a combination of treatments may work best. Smaller veins and spider veins are usually treated with what's called sclerotherapy or laser therapy on the skin. And this is what the before looks like, and this is what the after looks like. Lifestyle and home remedies, because I know a lot of us like to talk about home remedies that we can use as well. I'm one of them. So exercise, getting moving is important. Managing your weight is important. Avoiding salt. So follow a low salt diet to prevent swelling caused by water retention. Choose proper footwear. Now, some people might think that wearing high heels would actually be better, but it's not. Low heel shoes work your calf muscles more, which is better for your veins. Avoid tight clothing. So you see a lot of people like wear tight clothing around their waist. You don't want to wear tight clothes around your waist, legs, or groin because these garments can reduce blood flow. Raise your legs. To improve the blood flow in your legs, take several short breaks daily to raise the legs above the level of the heart. So if you're in bed, you can use pillows to elevate your legs. If you're watching television, you can just elevate your legs. That's important as well. You want to avoid long periods of sitting and standing. So you want to change your position frequently to encourage blood flow. What are some complications? Complications of varicose veins, although rare, can include ulcers, blood clots, which is a medical emergency, and bleeding, because the veins close to the skin can burst. Prevention. Improving blood flow and muscle tone might reduce the risk of developing varicose veins. The same measures that treat the discomfort from varicose veins can help prevent them. So you want to try avoiding the high heels, changing your sitting or standing position regularly, eating a high fiber, low salt diet, exercising. You want to stay active, raising your legs, as I indicated, watching your weight, and tobacco, which plays a big role in a lot of illnesses. You want to quit smoking if you do smoke. I want to give special acknowledgement to the Cleveland Clinic, Mayo Clinic, Hopkins Medicine, vascularsociety.org, and vascularcures.org for the information that I provided to you today. I hope this was helpful. Please join me in the Zoom room, and I'll be happy to answer any questions for you. And I may have some surprise information to give you as well. Enjoy the rest of the service, and God bless.